Sorry about that. We're about to get this real quick. Let me get the link again, and we'll get started here. Sorry, we're having some technical difficulties, but I think I figured it out. Here we go. Happy birthday. I see a birthday in here. All right. Okay, here we go. All right, can y'all hear and see me? Yes, yes, yes. We're good. We're good. Okay, cool. What about? Okay, cool. Okay. All right. So let me see where this is. Okay. Um, Thank you. I'm back. I'm back. We're doing, we're rotating some nurses around as well too, because they are some of our there are top educators as well too, right? So they're coming in and they're doing certain topics as well that kind of that they specialize in. But today we're going to get into alcohol intoxication and withdrawal, the difference between the two. And the reason being is that it is, in fact, something that is very prevalent. I'll talk about that. But real quick, couple of announcements. As usual, financial assistance letter, give it out to whoever you can because of the fact that you never know who's going to be able to help you. Religious community organizations, anybody will be able to receive that letter. It's a template. Tutoring, make sure if you need one-on-one tutoring, our tutors are all products of NCLEX High Yield. They were where you were at, and then now they're trained by me, and they report to me as well too. Use all our free resources. Make sure you're on our YouTube, Instagram, TikTok, Facebook group, podcast, so on and so forth, because we put out different things on different places. And then our self-paced course is now available. We're updating some notes, updating some videos as well too. And then our January live course. But more importantly, what I want to talk about with this Zoom is we're donating. I deal with a elementary school. Those of you that know my background, I wasn't very fortunate growing up, and now I'm in a very fortunate situation where I can give back. This school has 37% of their children are homeless, 5 through 10 years old. They're homeless. They live in vans, in cars, in shelters. They don't have food during winter break because the government pays for their food during school time. During winter break, they have no food whatsoever. So we've put a link there. If you can, please donate anywhere, $5. If we can raise $100, that's 100 loaves of bread, 100 loaves of bread for 100 students, 100 kids that are 5 to 10 years old. That's like sandwiches over winter break. So something so small goes a long way. So I definitely match everything as well too. We don't accept, like, my birthday is coming up on Monday. And everyone around me is not supposed to give me gifts. They're only supposed to donate canned goods, non-perishable items. So something I'm very, very passionate about. So if you want to watch the video, it's on YouTube. It's on our Instagram. The kids are so grateful. They're like, canned beans, corn, bread. Like, this is like, they're so excited about the little things that we take advantage of. So just, if you can, I would really appreciate it. On-demand course, again, is on there. If you have questions, scan this QR code. If you have questions, we will call you. I've been making calls all day. Anybody in here talk to me recently? Put in the chat. I really do pick up the phone and call. But let's get into today's topic. Why is alcohol intoxication and alcohol withdrawal such a big topic? Well, alcohol in general has become on the forefront of the news because the thought process was that we had one glass of wine, there we go, somebody spoke with me today, one glass of wine, one glass of whiskey, one beer, so on and so forth, and it was okay. That's completely inaccurate. I've been saying it for a long time. With what mnemonic? My mnemonic is needs, right? And needs, the E is exercise, and ETOH, which is alcohol. And with alcohol, I've always said avoid, avoid, avoid. So on the boards, if you see avoid alcohol, then choose it. It's part of needs. It's part of that select all that apply. But a lot of people confuse alcohol intoxication with alcohol withdrawal. So alcohol intoxication is when you've drank too much. Alcohol withdrawal is when you drink too much and you stop. So there's a lot of different things that can happen. And the comparison between the two makes for a great case study, which is what we're going to do today. We've created a case study that's going to show you the difference between alcohol intoxication, alcohol withdrawal, and then delirium tremens. So these three things, are they all related to alcohol? Yes, 100%. But not only that, they all have a great way of making a matrix or a grid, which makes for a great case study. Or knowing the difference between them and diagnosing and knowing how to treat them. Because what did I say? Freebie question, diagnostic, bow tie. And guess what we're going to be doing again here today? We're going to be doing some NextGen. Because a lot of our students that are getting 85 and out, 85 and out, 85 and out, as you will see, are going to be doing they're going to be seeing more case studies and bow ties than anything else. But before we get started, I do have a couple of people that made it to the other side. So let me find it is, let's see here. Wait, where are we at? VT, no, okay. I don't see Veronique in there, and then Grace. There we go. Grace is here. Let me stop share. There's Grace. Where are you at?
Hello.
Hey, Nurse Grace. How are you?
Hi, I'm good, Doc. How about you?
I'm doing well. I'm doing well. Well, welcome to the other side.
Thank you so much.
You're very welcome. How many questions were you?
85.
85 and out. I was just talking about it, and 85 and out. Here we are. Nurse Grace, what of NCLEX High Yield did you use?
The podcasts.
Just the podcast, like you use the free stuff.
Yes, and then YouTube as well.
And YouTube. So we use the free stuff and still made it to the other side, 85 and out. So what is your advice for people on the other side?
I think right now, honestly, I really recommend to listen to Dr. Z's podcasts because they were so helpful in like giving me the confidence to face the exam. I failed my first NCLEX exam actually earlier this year, and I didn't study as much as I thought I should, I think, and it was the lowest point in my life. And
Wow.
like I took a break from, life, and I had this thinking, and I was like, okay, I'm gonna make sure by the end of this year, I'm gonna ace this exam. So yeah, the question is, how did I do that? So I did a bunch of research and stuff, and I came across you, and I was like, okay, let me just try and see how you feel. And I was very surprised. You were different from the other stuff that I tried out. Like your voice was just so chill, and the vibe was just, it was just there. Like it was so inviting, and it made me feel so reassured that, that if other people got this, then I got this as well.
100%. 100%. Yeah. I think there's such a great takeaway, Nurse Grace, that you've offered is one, you don't have to spend money. Okay. If you need more, you can always get more, but we offer free resources and we encourage it as well. So we definitely do appreciate that you were able to find us and utilize that to the max. And then the second takeaway is definitely the fact that never give up, right? I mean,
Yeah.
there's always a low point. We always feel discouraged. Sometimes we get anxious, depressed. It happens to the best of us. It's happened to me. So, Nurse Grace, I mean, here we are on the other side. Congrats, congrats, congrats.
Yeah, I also want to give one more advice. On the day of the
Yes.
exam, I was facing a lot of anxiety, and I know a lot of people are gonna also probably have the same feeling as well, as especially on the day of the exam. I recommend everyone listen to Dr. Zeeshan's meditation
Oh yeah.
podcast. Yeah, and then the also one of them was listen to the day like of the exam episode. That one really helped me a lot to calm my nerves down and just take it as it is and
Yeah, I
be
mean,
honest.
I think like you said, my voice being stuck in your head is it's annoying, but it's good on test day. It's good on the day of the exam, maybe even the day before the exam to kind of calm you, especially if we're doing meditation together. So yes, absolutely take advantage of those free podcasts because I put them together for a reason. So Nurse Grace, thank you so much for sharing your story with us and congrats to you.
Thank you. Thank you as well, Doc.
You're very welcome. You're very welcome. All right, Nurse Veronique, if you're in here, just please go ahead and message in case I didn't want to miss anybody's testimonials as well too, because I love hearing testimonials like that. It's why we do what we do. So with that said, let's get into the difference between alcohol intoxication versus withdrawal. So again, alcohol intoxication is where we drink too much. And alcohol withdrawal is again the taking away of the alcohol when we've been drinking heavily or for an extended period of time. So the couple of things that we're going to see is again signs and symptoms, right? What about signs of onset? Well, after heavy alcohol intoxication, we're going to develop what's called Wernicke's. Wernicke's encephalopathy is going to be what? A receptive and a receptive and expressive aphasia. Receptive and expressive aphasia. So what does that really mean? Well, receptive aphasia, think about this. If you're talking to somebody that's really, really, really drunk, are they going to be able to receive what you're talking to them about? Are they going to be able to understand what you're talking to them about? No. So they're not going to be able to receive what you're saying. So that receptive aphasia is a part of being intoxicated. That expressive aphasia is also a feature of intoxication, means that they can't talk to you. So when they're trying to express to you, can you understand them? Oh, slurred speech, right? Stupor. So again, that expressive aphasia. So you'll see these terms, but understand what they mean, right? Don't just memorize them. I mean, receptive aphasia, they're not going to be able to understand you because they can't receive what you're saying. Expressive aphasia means that they can't express what they're trying to say in a proper manner. And that's from intoxication. With too much alcohol, we're going to have sedation and respiratory depression. Our vital signs are going to be depressed. Everything is going to be depressed. Alcohol is a depressant. So think hypotension, bradycardia. But alcohol withdrawal. Now, when does that start to happen? Well, think about somebody that drank last night and then they woke up. So maybe 6 hours later, 8 hours later, 12 hours later, and they wake up and they're like, oh, I feel like shaky and jittery and anxious. So initially with withdrawals, we can start to feel that anxiety, headaches, good, tremors. They start to feel this tachycardia. Their blood pressure is high. They probably don't even know it. Maybe they're even sweating. But what are we going to do about these situations? So management. Well, in alcohol intoxication, if they come in intoxicated, what do? We give them fluids, a banana bag, but we're also going to monitor their airway, right? Give them glucose. So again, thiamine, vitamin B1, which is what's deficient in Wernicke's. In withdrawal, we're going to give them a benzo. We're going to have to help their CNS because we don't want them to go into the worst case scenario, delirium tremens. Delirium tremens, or DTs. But what is delirium tremens? Well, altered mental status with seizures. Altered mental status because of seizures, delirium tremens. And that happens from alcohol withdrawal. Alcohol withdrawal. Is DTs deadly? Yes, 100%. 100% it's deadly. So we have to be very careful. And the way that we take care of that is with benzos. So management, again, I talk to students all the time. I just kind of made a video about this as well too. We talk about basic care and comfort. So basic care and comfort is arguably one of the biggest subjects that you're going to see on your CPR report. And most people that don't pass are either near or below. But it's everywhere. It's across the board. So in intoxication or withdrawal, do we have to care and comfort them? Absolutely. Does that mean management? Yeah. Does that mean medication? Yeah. Does that mean positioning? Yeah. Does that mean education? Yeah. Do you see how basic care and comfort is everywhere? It's not its own subject. So again, the one that we're concerned about is withdrawals. So we're looking at a time frame, but any time frame that we have, we're worried about them going into seizures, period. It doesn't matter if it's 6 hours all the way up to 96 hours. Between 6 hours and 96 hours, if somebody's been heavily drinking or has been drinking for an extended period of time, they are at risk for seizures. So we are watching them like a hawk, and we're actually going to do prophylactic treatment. So with mild withdrawal, yeah, maybe that's somebody that just got really, really, really drunk the night before, doesn't have a history of it, but they're feeling really, really bad. They've got that tremors, the anxiety, the sweating, their GI is upset. Maybe they're not even hungry. So what are we going to do about that? Well, give them the calm, quiet environment. Let's get them fluids. Make sure we got them electrolytes. Hydrate, hydrate, hydrate. And we give them something to help with, essentially help with their hangover. Because at this point, they drank a lot. They're probably going to be hungover, is that loose term, not medical term, but loose term. But those of you who don't know my background, I actually have created, and I'm not trying to plug this, but it is something just to show you. It's called Hangover Solved, and I created this over the course of a decade with all my background in studying, but it's full of electrolytes and antioxidants. So it is something that we give them, but people will drink Pedialyte, Gatorade, whatever, something. Give them the electrolytes that they've lost. Because what electrolytes are we worried about? What vitamins and minerals are we worried about? Again, vitamin B1, and magnesium. Along with, what else do we pee out? Potassium, sodium, right? So look at those main ones, because with potassium, we're worried about dysrhythmias. With moderate withdrawal, now we're getting into the point where we can get into DTs. In this window, depending on how much and how long they've been drinking for, we're worried about DTs. So that 12 to 96 hours. So it used to be thought 3 days, 72 hours. It goes all the way to 96 hours now, because we've seen seizures happen at that point. So what signs and symptoms are we looking for? With withdrawals, increased heart rate, blood pressure. Remember, if I give you something like alcohol and it's a depressant, when I take it away, you're going to become hyperactive in everything. So everything that I gave you, it decreases your heart rate, it decreases your blood pressure, it makes you sleepy. Now you're going to do the complete opposite. Now you're going to be agitated instead of euphoric. You're going to be hypertensive, tachycardic, tachypnic. So everything that it did for you, when I take it away, it's going to do the opposite for you. So keep that in mind. Just make sense of it. Don't try to memorize it. If you understand what alcohol does, well, then understand that when you take it away, it's going to do the opposite. And what we're worried about is that altered mental status. So again, the drug that we're going to give, our drug of choice, is in fact lorazepam. With lorazepam, what type of a drug is it? Let's talk a little bit of pharm right now. It is, in fact, a benzodiazepine. A benzodiazepine. Do you think benzos are high yield? 100% they are. So things like lorazepam, alprazolam, why? They're highly addictive, and we're dealing with mental health and anxiety. So we were giving, now take some notes on benzos. Why do we give benzos aside from withdrawals? Typically we give it for anxiety. And it was given so frequently and so openly that people became addicted to it. And benzo's also a depressant. So when we're dealing with benzos, identifying the drug is very important. Identifying that it is, in fact, something that's going to suppress your CNS, which means if I take it away, it's going to do the opposite. So again, this is given for seizure precautions when we're talking about withdrawals. And we're also going to do frequent vital and neuro checks. And again, we go a little bit more when we get into DTs. When we get into DTs, now we're going to put them in the ICU because we have to make sure that they're not going to die from these seizures. So again, we're going to get them on IV fluids. Wait a minute, hold on one second. Do you think we made them NPO? Yeah. Started them on IV fluids? Yeah. If they're not eating, you think we got them a PPI while they're in the ICU? Yeah. Wait a minute, where am I going with this? If they're feeling nauseous, antiemetics? Yeah. You see how NIPA is not just a GI thing? NIPA, I'm talking about it in mental health. I'm talking about it with substance abuse and withdrawals. So I just talked about needs. I just talked about NIPA. So if you don't know these things, make sure you know them. They're going to help you on test day. And if they do end up having any type of respiratory issues, we've got to get ready to intubate them. So again, the severity of it is very important. So a couple of new quick tips. You can totally screenshot these if you want. The 3 T's of Wernicke's encephalopathy. It is thiamine deficiency, tremors, and you're going to see that tired eyes because again, they've got that Wernicke's encephalopathy. The next quick tip is watch for alcohol withdrawal symptoms. Withdrawal or seizures within that 6, and I'm going to actually modify this to 96 hours. 6 to 96 hours. That anxiety and agitation, tremors, the earliest sign. You're going to see somebody come in and they're going to do one of these. And you're going to notice it right away. Confusion and that hypertension, hyperreflexia. Again, what type of a question are with these withdrawal symptoms? 100% select all that apply or matrix or grid. So again, how are we going to manage this? Benzos, thiamine, magnesium, multivitamins, and if needed for the hypertension and tachycardia, beta blockers. Beta blockers. In our priority, always ask graph airway. Then is the other A in ask graph, which is altered mental status, meaning seizures. Meaning seizures. We're going to monitor their vitals, prevent any type of complications, and again, the medications we just covered as well too. And I want to get into some practice questions, especially these NextGen. All right. Let's do a bow tie. So we've got a nurse caring for a 46-year-old male patient admitted to the ER with a history of chronic alcohol abuse. Reports last drink was 18 hours ago. What if this was 6 hours ago? Would we still be concerned? Yes, because of the chronic alcohol abuse. So again, that's 6 hours, even an hour, 2 hours. I mean, as soon as that alcohol gets metabolized, the last drink gets metabolized, they're at risk. So again, 18 hours. And then the patient appears agitated, restless, and states he's seeing bugs crawling on the wall. Bugs crawling on the wall. So again, we're starting to see what? Which one to ask graph are we seeing? Altered mental status, 100%. So again, making this a little bit more specific, nurse's notes. Restless diaphoretic, we kind of went through these already ahead. No signs of head trauma, again, anxious, bugs crawling. But vital signs, heart rate elevated, blood pressure elevated, respiratory rate elevated, temperature elevated. Everything goes up when I take away things that make you go down. Oxygen is okay. And we take a diagnostic test. We did a head CT. Everything is fine. Sodium, low. Potassium, little low. Magnesium, low. Glucose, fine. Thiamine, low. So again, we probably got rid of this. How? How did we get rid of this? These electrolytes. We got rid of them. We got rid of them through urine. Yeah, exactly. As we were drinking, we got rid of them. So now we do a bow tie. The thing about bow tie is what? We needed to diagnose what's going on here. And when we diagnose, it is what type of a question of the 5 types of questions? Is it a select all apply? No. Prioritization? No. Further teaching, further intervention? No. Is it a freebie question? Yes. It is 100% a freebie question. So a bow tie is not complicated, but you must be able to diagnose what's going on, which means as I've been teaching since the day I started teaching, what do I teach you? If I teach you one diagnosis, what else do I teach you? Another one that can be compared to it, another one that can be compared to it, another one that can be compared to it. I've been doing this since day one because that's called a differential diagnosis. All the different diagnoses that you may think this could be. So what are our options here? Well, is it opioid withdrawal? Did we have any type of opioid use or history of opioid use? No. Delirium tremens, hallucinations? Yes. Okay, cool. Right? Alcohol intoxication, is this intoxication? No. Their last drink. Okay, Google, stop. Okay, Google, stop. We're just gonna let Google finish. Sorry about that. Oh, you can't hear it. Okay, it was nonstop. Okay, cool. Maybe because I got the mic on. So Google is going on. But this is not intoxication. This is in fact delirium tremens. Wernicke's encephalopathy comes with what? Intoxication, right? So again, this is not intoxication. This is 100% withdrawals. But to the point, is this regular withdrawals? Tremors? Anxiety? Hypertension? No. What's differentiating this that I am worried this person's going to have a seizure like right now? What about this makes me scared about this patient? What was in there? The hallucinations. That altered mental status means that this person is about to have a seizure. So what are we going to do about this? So again, look at how easy freebie questions are. Freebie questions are, let's go back up here, diagnose this person that has a history of alcohol abuse, bugs crawling, anxious, all the vital signs are elevated, electrolytes are low. Okay, cool. Well, are they intoxicated? No. So that eliminates Wernicke's, that eliminates intoxication. And was there any indication of opioids? No. So it's a very straightforward question. So when you get a freebie question, I mean, a bow tie question on your exam, which you will, just realize it's a freebie question. So take a step back and be like, oh, what's the diagnosis? That's it. Simple. And they will give you enough clues to make it that simple. So what are we going to do about this? Whoops. It is, in fact, Which one was it? 3. Okay. Now the action to take. Action to take, what's another word I can say? How am I going to treat this, right? How am I going to treat this diagnosis? Fair? How am I going to treat it? What am I going to do about it? What type of a question? I say pharm, diagnosis, and treatment are 100% freebie questions. Treatment, intervention, interchangeable, right? Action to take, they're all freebie questions. So don't overthink a bow tie. Look, a freebie here, freebie here. So what are we going to do? Well, magnesium, maybe. High Fowlers, probably going to put them on what am I going to do with the person that I'm afraid is going to have a seizure? Put them on their side, right? So I'm looking at thiamine, okay, and lorazepam. Now I'm down to 3 of them. Of these, which 2 am I going to do first? Thiamine and lorazepam. Thiamine and lorazepam. Magnesium will come, absolutely. But magnesium is not the one that I'm worried about with the encephalopathy or the withdrawals. I'm worried about lorazepam and thiamine. Lorazepam and thiamine. So again, 1 and 2. But we've got to monitor them. So monitoring them on their actions or on their diagnosis is what? It's education. It's education, right? So are we worried about their vital signs? Are we worried about aspiration? Are we worried about glucose, or are we worried about seizure activity? Well, of these, the first one I'm worried about is what? Seizure activity. Seizure activity. And then now we're down to glucose. What do we think? Aspiration. Are we worried about aspiration? We're more worried about their I would agree with the majority of you. I would agree with hemodynamics, right? Hemodynamics. So again, we're going to monitor their seizure activity and their hemodynamics because again, their blood pressure and heart rate went through the roof. So what medications are we going to give for that hemodynamics, for that vital sign that's through the roof? Beta blockers. Good. Beta blockers, right? So what about beta blockers? Real quick, let's do a quick rundown. And I'm gonna throw one at you that you probably don't know, but it's starting to get tested. So we know beta blockers, lower heart rate, lower blood pressure, cool. We know beta blockers, we're worried about bronchoconstriction and bronchospasm. So we're worried about what's it called? Asthma and COPD. Those are the ones that we all know. What can beta blockers be prophylactically prescribed for? Good. Migraines. And, oh, that's a good one too. Somebody brought up anxiety, but migraines is one that people overlook. That it can prophylactically, the word was prophylactically, right? Not treatment, but prophylactically given. So treatment for anxiety, sure. Treatment for elevated heart rate, especially people taking tests, right? Taking the NCLEX. People get prescribed propranolol all the time. But the one that gets overlooked, the one that's not taught, that I'm teaching you right now, is prophylactically, not treatment. Look at the word I'm using, prophylactically, meaning I'm giving it to prevent migraines. The other ones are treatment. Graves, treatment. Yeah, of course. Tachycardia, hypertension. Yeah, of course. We can give that. If we got an aortic dissection, yeah, beta blocker, treatment. But the one word I use was prophylactic. Now look at a question I can ask here. Now write this question down because it's exactly how I would ask this question. Ready? Which of the following is the appropriate use for prophylactic treatment or prophylactic use of a beta blocker? So which of the following is proper as a prophylactic use of a beta blocker? Well, you think I'm going to throw in Graves' disease or hyperthyroidism? Sure, I'm going to throw that in there. Am I going to throw in anxiety in there? Sure, I'll throw that in there. How about essential tremors? Sure, I'll throw that in there too. And the last one I'm going to throw in at you is migraines. But what in the question stem was the definitive term that I'm not going to use it, that I'm not going to choose hyperthyroidism. I'm not going to use this and use it for essential tremors. And I'm not going to choose, what was the last one I chose? It was, I forgot the answer choices that I gave. Essential tremors, it was hyperthyroidism, and then there was something else, and then migraines. But the word was prophylactic. So again, you'll look at these questions, you'll be like, oh, they all look good. But the one question was anxiety. There we go. Thank you, anxiety. But the one word that I used was prophylactic. So now you look at this and you see beta blocker, and you don't read the question in its entirety, and you're like, well, I can use it for hypertension, I can use it for anxiety, I can use it for what's it called, Graves, but migraines. But the one word was prophylactic. So look at every single word when you're doing questions. That's a question that I just made up off the top of my head, but it's a great, great question. All right, let's get into a case study. So with the case study, they're going to give you everything. Okay, it's not that you're out here trying to figure things out. It's going to be very evident to what's going on and what the diagnosis is. But it's what the following questions ask that's important. So again, we're dealing with a 48-year-old history of chronic alcohol abuse. Last drink was 24 hours ago, but again, bugs crawling on the wall. History and physical, our first tab. Alcohol abuse for 15 plus years, smokes a pack per day. Okay, last drink 24 hours ago. Anxious, keep seeing bugs. Agitated, restless, constant tremor in both hands, pale skin, oriented to only person, confused about time and place. So again, altered mental status. But again, what am I diagnosing right now? Is this alcohol intoxication? Is this alcohol withdrawal? Is this straight up DTs? It's on the verge of being DTs. There's delirium there. There's delirium and tremens. Delirium tremens doesn't necessarily mean seizure alone. Delirium tremens means that they're delirious and there's tremens, right? So again, what we're worried about happening is that seizure. So now we've got a heart rate of 130, blood pressure 170 over 98, respiratory rate 24, all elevated, sodium low, potassium low, magnesium low, thiamine levels low. So now our first question is, which three findings require immediate follow-up? So I use the method and I look at this and I say, okay, we're talking about priority and we're talking about a select all that applies. So I'm literally looking at what I'm freaking out about and I'm choosing three of these. Thiamine deficiency, low potassium. So thiamine deficiency, is that something that we're freaking out about right now? Thiamine deficiency? No, we're not freaking out about it. Okay, not yet. That's not something, but we'll get to that. How about the potassium level? Is that something I'm freaking out about? Because what if ask graph does that become? It becomes the K. It becomes the K in ask graph. Look, I'm telling you right now, I'm looking at immediate, I'm looking at prioritization. So I'm looking at ask graph. Still applies here. So yeah, I found me a potassium. Okay, that's one. How about tremors with visual hallucinations? Absolutely, that's altered mental status. Oxygen of 95? No, not really too concerned about that. How about blood pressure of 170 over 98? Maybe we'll hold on to that. Or a heart rate of 130. Which one are we going with? Which one am I freaking out about between the two? Now we're comparing B to A. Heart rate or blood pressure? Which one am I freaking out about? 100% heart rate. 100% heart rate. That blood pressure we can deal with. People have a blood pressure of 170/98 and don't even know it. We have a lot of wiggle room with blood pressure. They're not going to stroke out at 170/98. Now, if it was 210/110, now what are we worried about? There's a difference. Now we're worried about blood pressure. But heart rate is showing me that I've got some sort of tachycardia along with a dysrhythmia, potentially. But either ways, forget about the potential. The heart rate is 130, blood pressure is 170/98. Let's just break this down because a lot of people started going with B over A, so let me break this down for you. With 170/98, a lot of people walk around with blood pressure that high, correct? But if somebody has a heart rate of 130, do you think they're going to notice that right away? If my heart rate was 130, I'd be like, whoa, what's going on here? I'm palpating. I'm like, it's 130. You're like, whoa. But 130 heart rate, I'm going to do what? What's going to happen to me? Am I getting that warm, red, oxygenated blood out the way that I want to? No. Hypertension is a silent killer, but again, we're not at a dangerous level, but the heart is under a lot of stress. 210/110, now I'm worried about them developing a stroke. Now it becomes another one of Ask Graph. But between the blood pressure and heart rate, I'm going to stick with the heart rate because again, that blood pressure, it's probably going to be controlled, but the one thing that I want to get down right away is their heart rate. But am I going to address both of them with one drug? Yeah. Ultimately, I'm going to get what? I'm going to get them on beta blockers, right? So again, I'm going to address both. But if you chose hypertension, or if you chose the blood pressure over the heart rate, is that end all be all? No. Why? We get partial credit. Okay. So it's not, you still got 2 out of 3. You're at 66% at this point. That's still, we can raise that up. That's just one question. We're still at 66%. I want you to be in that 75 to 80%, but we can raise that up. So again, don't freak out about it. So little test taking strategies, a little bit of explanation, a little bit of Ask Graph, a little bit of everything, right? A little bit of cardio. You see how everything ties together? Literally, we're talking about mental health and alcohol withdrawal, alcohol abuse. And we went to cardio, we went to Ask Graph, we went to the method. Everything ties in. So don't think it's like one section. So again, we move on to identify what applies to the following conditions. So again, what is my approach to matrix or grid? Am I going to go hypotension and then decide which one? Or am I going to go alcohol intoxication and not worry about anybody else? I'm going to go down, always down, because I don't want to jumble things in my head. I don't want to go hypotension, then go from alcohol intoxication back to alcohol withdrawal, all the way to delirium tremens, because now I'm kind of jumping around. And then I got to go back with tremors and then go alcohol intoxication. Then I got to go alcohol withdrawal. Then I got to, do you see? That's just not organized thought process. It's just creating confusion. But if I was to tell you, let's just say that these were not here, and let's just worry about alcohol intoxication. Does that give you a clear lane, a clear thought process? Boom, I know alcohol intoxication. All right, if they're drinking too much, are they hypotensive? Sure. Are they having tremors? No. Are they having hallucinations? No, they're drunk. Are we going to give them lorazepam? No way. They're intoxicated. That's going to increase their respiratory depression, which is the last one. But do you see how my thought process was just focused on alcohol intoxication? So now, whoops, get rid of this. Now I do the same thing, I just move over. So anytime you get a matrix or grid, this is how I want you to approach it. Test taking strategies, okay? There's a method to my madness. There's a method to my madness. Alcohol withdrawals, I know what that is. Hypotension? No. Tremors? Yes. Hallucinations? Hallucinations? Okay, I'll go with the majority. Are we going to give them lorazepam? Okay, I will take yes on that one. And respiratory depression in this situation. I'm going with the majority. Well, look, this is all a process. This is a learning process. I want you to see how it would be on test day. So I'm going with the majority. It's okay. Delirium tremens, hypotension? No. Tremors? Yes. Hallucinations? Yes. Administer lorazepam? Yes. So now I go down and I compare my answers. So again, the hallucinations comes with the delirium tremens. It's in the definition. It's in the definition. Delirium is altered mental status. Hallucinations is altered mental status, right? So you see, they're giving you in medical terminology. Look, I always say this, and I say it jokingly, but not really. None of us learned medical terminology as our first language. We 100% need to understand and break down words. That's why when I teach you receptive versus expressive aphasia, don't memorize it, understand what's happening. Delirium tremens, altered mental status with tremors. Have we hit seizures yet? No, but are we going to? Potentially, yeah. More than likely, yeah. But let's just say that we did choose this, okay? Now I got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Out of 15, I got 14 correct. Somebody do the math there. I know it's 90, what? It must be 96, 96, 90-ish, 96%. Somebody do the math for me real quick. I don't have my calculator on me. That was just off the top of my head. Something like that. 93. Thank you. I was off. 93%. Now somebody do this math. 93, 66. So what is that? 150. What is that? 159? Right? 159 divided by 2. I'm at almost 80%. Do you see that 66% in the beginning? We just raised it to almost 80% just by doing the next question and not dwelling on the last question and not dwelling that we even got this one wrong. This is why my students are 85 and out. This is what I'm teaching you. Don't dwell on the last question. Focus on the question after. Focus on what's in front of you because that's another chance to get you up. And now we're at 80%. If this was question 85 right here, and we were at 80%, you think the computer's shutting off? You think you're seeing a pass? 100%. This is what I'm making my students, this is what I'm showing you, right? I figured things out that nobody else is going to show you, and I want you to take it. So I appreciate that. Thank you for the compliments. I really do appreciate that. We put a lot of hard work into this, my team and myself. The client is at risk for developing, well, delirium tremens, seizures, or Wernicke's encephalopathy. Well, let's start with the bottom. Compared to seizures, Wernicke's encephalopathy, well, that's when they're intoxicated. So again, we're using the method, right? We're using the method. Between Wernicke's and seizures, I'm going to choose seizures. Between seizures and delirium tremens, well, we're at what level are we at? So between the two, compare it. What are we worried about happening? Risk for developing. Seizures, good. Why not delirium tremens? They already have it. They have it. So do you see why I threw that in there? I threw that in there on purpose. It's to throw you off. It's to show you that, well, they already have it. But what am I asking you? What are they going to develop? You see the one word, but it's a freebie question. And why are we developing that? Severe alcohol withdrawal or low magnesium levels? Between the two, again, we're using the method because of alcohol withdrawals. Now I'm down to 50-50 between alcohol withdrawals and thiamine deficiency. Alcohol withdrawals. Do you see that this is the method? Have we deviated from the method? I use select all that apply method. I use the method. I'm telling you prioritization and ask graph questions. I'm showing you select all that apply with signs and symptoms in matrix in a grid. I'm giving you a freebie question by seeing what they're going to develop and because of what. Freebie questions. These are straightforward, easy drop-down questions. And now we just got 2 more questions right. So out of 6 answer choices, 1, 2, 3, 4, 5, 6, we got 100%. We were at 80%. Guess what we're averaging now? Do the math. It's pretty simple. We just went up to 90%. We just jumped up to 90%. So again, very important. Whoops, this is wrong. Sorry. This is right. I made a mistake. My bad. I'm human. So it is, in fact, seizures. The delirium tremens is a mistake. So again, make that correction if you're paying attention here. We are going right here. That is, in fact, seizures. Oh, no. What did I say? I'm so wrong. I just confused my own self. Sorry, long day. This is correct. It is actually delirium tremens. It's not wait, no. It is seizures. No, I'm talking myself out of my own answer. It is seizures. It is seizures. They already have delirium tremens. Woo, long day. So yeah, it is in fact seizures. That is incorrect. So yeah. All right. So now again, intervention, education, right? What type of a question is education? Of the select all that apply, it's one of the 4. It's one of the 4, right? Select all that apply can be what? Risk factors, signs and symptoms, education, and concepts. So with intervention, it could be further intervention as well too. But with delirium tremens, what are we going to do? What is expected? What is not expected? So are we going to give them lorazepam with delirium tremens? Yes. Are we going to give them thiamine? Yes. What about dextrose without thiamine? Well, doesn't that just kind of contradict what I just said yes to? So again, I want to make sure I have that thiamine in it. Now, if I had dextrose with thiamine, cool, absolutely. And then calm, quiet environment. So again, there you go. So again, case studies are not that complicated, but you're going to see more and more case studies and bow ties. Anybody recently take the exam will tell you that if you're 85 and out, majority of your exam is going to probably be case studies and bow ties. So now we're on item 5 of 6. Item 5, there you go, 6 case studies. Item 5 of 6, which client statement requires immediate follow-up? So what am I freaking out about? So what type of a question is this? It's prioritization question. It's what? When I'm freaking out about, what am I looking for? Find me, ask graph. But we're going to use the method. I feel anxious and sweaty, or I haven't eaten in 2 days. Between the two, I'm not going anywhere else. Don't even look beyond that. Between D and C, using the method, what am I going to do? D over C, excellent way of answering it. D over C, right? I'm choosing D over C. Using the method, D over C. Now, I compare D over B. I feel like I'm going to have a seizure, or I feel anxious and sweaty. Which one of ask graph am I worried about with B? I said to find me one of ask graph. 100% altered mental status. So I feel like I'm going to have, so I take that one, and now I'm down to 50-50. I feel shaky and my hands won't stop moving, or I feel like I'm gonna have a seizure. Again, B over A, excellent way of using the method and saying B over A and identifying ask graph. So look, using the method ask graph on a prioritization question, there you go. It makes it a lot easier. It makes it a lot easier and straightforward. Excellent job. And the last one. So which of the following indicates whether it's improving or not improving? So in this situation, the heart rate has decreased to 90. It was at 130, so improvement, yeah. Reports no more visual hallucinations, yeah. And potassium is now at 4.0, yeah. So again, look at how well we did. I mean, we did this collectively, but this is a case study. We compared alcohol intoxication to alcohol withdrawal, all the way down to delirium tremens. Understanding the signs and symptoms, understanding the treatment, the pharmacological aspect of it, the interventional aspect of it, the basic care and comfort of it. Do you see what I'm teaching you here? Using the method, ask graph. I mean, look at how much we've covered in what you may have thought was just going to be one topic of alcohol intoxication, because that's what I wrote, right? But that's why it's so important to join our Zooms. That's why it's so important. If you feel like you don't understand to the level and the extent that I've talked about, if you are not getting to that level, then consider doing the on-demand or the course, because this is how far I want you to think. Because what do I say to my students? If you think like me, a test maker, not a test taker. I really appreciate the compliments. It feels so good to be back. I miss lecturing. I'm gonna have to kick all the other nurses out and start doing it myself again. I'm just kidding. So with that said, remember we got the free trivia starting here in a little bit. I'm gonna hand it over to Nurse Brittany. She's gonna do free trivia with you all. What I'm gonna do is I'm gonna edit this because I made a few mistakes. I'm gonna try and edit it. I'm gonna try and put it up on YouTube and the podcast. So make sure you subscribe to YouTube. Okay. Make sure you subscribe to YouTube. If you like this lecture that much, make sure you please spread the word. That's all I ask. Please spread the word. Just talk about the free Zooms. Talk about us in general, anywhere you can, Reddit, Facebook, anywhere, to your friends, whoever you can. We really appreciate it. We do this for you all. If you can donate, please, 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 $4.99. It goes a long way. That's 5 loaves of bread. That's 6 cans of canned goods. That's soup for these kids. They don't have microwaves or fridges. They're sheltered. I mean, they're 5 to 10 years old. So anything you can donate. We'll put the link in there to donate as well too. Please, please, please. My birthday's on Monday. And all I ask for my birthday is a donation for these homeless kids. That's all I ask, because I will be I'm going on my birthday. I volunteer on my birthday to these kids. I go to their school. We hand out everything. These kids come up and give me a hug. I mean, they are so excited about canned goods like green beans, corn. Imagine something that we overlook, that we walk past in the aisle. They're so grateful for it. And to get them by when they're not going to get food for 2 weeks, that's all I ask for my birthday gift. I do all this for free for you all. If you all can please donate, I mean, anything, if you can. So with that said, thank you all so much. If I did anything to offend anybody, I apologize. If I can get better, please let me know how. We also have another pop-up for charity with Nurse Zena as well too. It will be on Sunday. We're going to announce that. So make sure you sign up for our email. You're following us on all our social media. We're going to announce that one as well too. We're trying to raise as much as we can before Monday. I'm going shopping on Sunday and Monday morning to load up. I will be posting everything that we get, that we gather from all y'all's donations as well too. So thank you all for the birthday wishes. Thank you all for joining me. And I'm going to hand it over to Nurse Brittany. We'll take a little break. Let's take a 5-minute break and we'll come back and start trivia.
I'm gonna give everyone till 7:10 Eastern time to join, and then we're gonna get started. Okay, we're going to go ahead and get started. Okay, let's go over this one together. Hold on one second. I'm just trying to figure out the Zoom looks a little different on this on my MacBook instead of my iPad. Let me just figure out how to move this. Can everyone hear me? Sorry, I'm used to my iPad. I'm used to the Zoom on my iPad. So which is the priority? Is that yeses? Okay. So which is the priority nursing action for a client experiencing chest pain unrelieved by nitroglycerin? So perform a 12 lead ECG. Why did we not go with this one? Why not? Or why did you go with this one? Why did we go with D, for those of you that went with D? Yeah, I wouldn't go with D because yeah, like you said, Petros, it's not solving the problem that we have. Um, I'm freaking out about this. This is an emergency, so I would say priority is to call the rapid response team. It's not wrong. I just wouldn't say it's priority. Yeah, yeah, you guys are all right on point, right on point. That's okay. That's all right. It's good. Honestly, I always say it's good to make mistakes because you learn even more and then you get even more questions correct, right? That's all right. So yeah, that's why I would go with option C. Okay. Nice job, everyone. Guys, the way that this works on your device that you enter the pin that you're playing on, you're only going to see the answers, I believe. Am I correct? You're only going to see the answers there, but I believe you have to look at my Zoom screen that I'm sharing to see the full question. Does that make sense to everyone? Okay, awesome. You guys are doing amazing. Okay, so let's go over this one. So which findings are expected? This is a SATA question. A nurse assesses for signs of hypocalcemia. So bradycardia, do we go with that? Why not? Why do we not go with that? Yeah, it wouldn't be Brady. It wouldn't be Brady, so I wouldn't go with that. What about tetany? Yeah, I wouldn't go with tetany, but positive trousseaus and positive chopsticks, definitely. What is positive trousseau? That's when you inflate the blood pressure cuff on the upper arm, right? And a positive would be a spasm, right? And what about positive Trousseau sign? I'm sorry, positive Chopstick sign. That's when you tap the facial nerve near the corner of the mouth, right? And a positive result would be a facial twitch. Yeah, exactly. Exactly. Okay, let's see. Which dietary recommendation is most is most appropriate? A client with pancreatitis has an elevated amylase level. Which dietary recommendation is most appropriate? Why not high protein? We want lean protein, so I'm not going with that. What about NPO? Do we like this? Why would we go with NPO? Because that's going to allow, yeah, that's going to allow the pancreas to rest and to help reduce inflammation. Yeah. What about low carbohydrate? Yes, no, maybe so. Yeah, I wouldn't go with low carb. NPO is gonna, yeah, C is gonna be the better answer here because like we said, we need to rest. And same thing with these other, and NPO is gonna be the most appropriate here for sure. Sorry, guys, I can't find my unmute button. It disappears from my screen and it doesn't come back up. Okay, so which intervention is the most appropriate? The nurse is caring for a client with SIADH. Which intervention is most appropriate? So provide a high sodium diet. Why don't we go with this one? Why am I not seeing? Exactly, exactly. So we get rid of that one. What about implement fluid restriction? Yeah, so like you guys are saying, SIADH causes the body to retain too much water, which leads to low sodium levels, right? Or hyponatremia. Therefore, you want to limit fluid intake to manage this. Yeah, exactly. Yeah, so why a beta blocker? What are they known to do? Slow the heart rate, right? And make that bradycardia even worse, yeah? Okay, sorry, it takes me an hour to unmute myself because it doesn't pop up. Let's see what this question. So, is this the question everyone's asking about? Is this the one? Okay, so let's go over it together. So, which finding is most concerning in a client receiving TPN? Okay, so TPN question. Okay, so diarrhea. Why don't we go with this? Sorry, guys, I have a little bit of a cold. Why don't we go with diarrhea? I would say, so for me, I'm thinking ass craft here, which is why I would go with, yeah, exactly. Which is why I would kind of chuck everything else and go with altered mental status, right? So I would just definitely, you could have applied ass graph here. Why not the hyperglycemia? Yeah, because of that mild. Yeah. Yeah, so I would stick to ass graph here. If anyone saw me over here, they would laugh. I can't, my mute little bar goes away and I can't get it back. Which is the most common side effect of opioid administration? So why did everyone go with respiratory depression? Why respiratory depression over the constipation? Because it looks like 66 of you guys went with respiratory depression, 7 went with that constipation. So respiratory depression is actually, I would go with A here over B. I think there was an error. I would go with respiratory depression. Yeah, let me just make sure I'm reading it. What is the most common side effect of opioid administration? Yeah, with opioid and benzos, we're always thinking respiratory depression. So I definitely would go with respiratory. Kind of throws you off a little bit here. It says most common side effect. I would throw this question away. This is a little confusing. Yeah, I would throw this away. I would throw this away. Yeah, it should have said which is like which one are we freaking out about the most? And then I would have went with A. So I see why some people went with B. This is confusing, this question. I would chuck this question. Yeah, I would actually B, I would go with B here, but if it said which am I freaking out about the most, which is priority, then I think airway, but not, it just says most common side effect. Yeah, I would go with constipation here. I think you guys were reading it as I was reading it first, thinking like we're freaking out about A, but that's not what it's asking. Yeah, it's not saying most concerning, it's saying most common, exactly like Hanan said. So most common, I'd go with constipation. Most concerning, which one am I freaking out about the most? I would go with A. Yeah, this is tricky. Yeah, they can try to get you with some questions on NCLEX as well. But yeah, you got to catch details like that. But this one is this one is tricky. If it said, like we said, if it said most concerning, I'd go with A. Most common, I'd go with B. Okay, which action should the nurse prioritize for a client in autonomic dysreflexia? Let's see, perform a neuro assessment. Why don't we go with this one? Why don't we go with this one? Because bladder distension is the most common trigger for autonomic dysreflexia, right? That's why we would go with check for bladder distension. Does that make sense? Because immediate bladder drainage could be necessary to resolve this. Exactly, Shadia, yeah? Awesome job, everyone. Remember, if you won first, second, third, fourth, or fifth, please send an email for your prize at contact@nclexhighyield.com. Okay, please don't forget to email. Congrats to those who won. Just remember, if you've won before, you can't win again, unfortunately. Okay, just a heads up. But I hope everyone enjoyed. I hope you enjoyed Free Zoom with Dr. Zeeshan. You guys did awesome. I hope you have a wonderful night, and we'll see you again next week. You're welcome. Bye, guys. Bye, everyone.